When looking up ways to treat low mood and/or anxiety, you'll see numerous references to mental health professionals such as psychologists, psychiatrists, psychotherapists, counsellors, CBT therapists, etc. The treatments available both within the NHS, if you can get a referral, or privately sought, can for some seem daunting when you're feeling anxious anyway. Firstly, there are a number of excellent experiential self-help books available. Many of my community patients have found these useful, as they are often an individual's account of their own anxiety symptoms and how they manage them. It can be so helpful to hear about someone else's experience, as anxiety can make you feel alone and vulnerable, and often that others around you struggle to understand your experience. However, when you're very debilitated by anxiety symptoms, having input from a qualified clinician can feel safer and more tangible. Cognitive behavioural therapy, or CBT, is one of the most widely accepted and commonly used evidence-based interventions for anxiety and depression. Aaron Beck is an American psychiatrist known as the father of CBT, who began developing the technique back in the early 1960s. CBT aims to assist the individual to look at how their thoughts and feelings affect their behaviour, and how changes to their maladaptive or unhelpful thoughts can affect change to their feelings and behaviours. There are a huge number of websites and books devoted to CBT and numerous pieces of research evidencing its effectiveness for treating a number of mood disorders. A CBT therapist will work within the principles of the CBT model, tailoring it to your particular symptoms and looking at your own personal triggers for anxiety. They then look at ways for you to challenge how you think, in the hope that this then changes how you feel and behave as a result. Cognitive Analytical Therapy, or CAT, was initially developed by Anthony Ryle in the UK and is based on the combined approaches of CBT and analytical therapies. Ryle is a GP and an analytically trained psychotherapist who noted through his work that analytical therapy was enormously beneficial but took a long time to get results. CBT, on the other hand, showed quicker and tangible results, but often left early learned experiences out of the therapy, which he felt was a vital component to attaining long-term results. CAT is a time-limited approach and focuses on the chain of events, thoughts, feelings, emotions and motivations that drive a person in a certain way. It identifies a target problem or behaviour for the individual and looks at how this occurs. The aim is to change these behaviours, having identified how they developed in the first place. Psychoanalytical psychotherapy was pioneered by Sigmund Freud in the 19th century and has undergone many refinements therapeutically over the years. This is usually a long-term treatment undertaken by a qualified and registered psychoanalytical psychotherapist. This therapy focuses on early childhood experiences and how this influences our thoughts, feelings and behaviours throughout our life. Counselling is a service which is also offered, and the British Association for Counselling and Psychotherapy is the main registering body to whom you should look to ensuring the person offering this therapy is registered and qualified. Advice and guidance with personal problems is the main focus of this approach, and people can find it both supportive and helpful when experiencing anxiety. These are some of the most common talking therapy approaches when exploring professional assistance with anxiety disorders.